just got out of hospital after my 24-hour stay here at the Royal Melbourne, and the big building with patients in it. Yesterday, as I was leaving, I took a photo of the hospital and I posted on Instagram. I was just a big thanks, big shucker, big thanks, boys, and thanks teams. They responded. The Instagram, the hospital's Instagram responded, and they were like, "Hey, did you want to single out anyone or single out any teams and give them a big thanks?" Because they've got some kind of competition going or whatever. Not competition, some kind of awards going on. And they're giving like a voucher or something away. And I read the link and I was like, there's too many people to thank. So I thought I'd make this video. And if we can, all right, I'm trying to rally support here. Everyone, if we can go through the records, you and the team, you and the hospital team could do that. Try and find everyone who had to interact with me, put them on the list and give them all the awards. And if they don't, and if you somehow the hospital, if you can't afford it, I'm happy to. I probably can't chip in. I'm poor, but what I'm getting at is I'll find something. I'll find something to help out so that everyone can get a really good appreciation, and maybe all get that award. You know. So I just spent 24 hours in the hospital, and initially I went in for an MRI because it's like a follow up. I had a colonoscopy a few months ago, but they didn't get too far because there was some swelling. So they booked me in for an MRI to try and like scan the rest of my intestines, and conveniently already had sore, swollen intestines. So I went in for the MRI, 2 birds, 1 stone, I thought, and then get the scan. And I told them about my abdominal pain, and they were like, "Hey, you probably shouldn't leave." So there was this really nice Irish lady in the MRI team, and she was like, no, you got to stay. We're going to get you checked up with a doctor. So it was a really good doctor who ran me through it. So anyway, so the doctor gets me to admit myself through emergency department, and then I get put through the triage. Triage nurses were really lovely, very lovely. And then I get put into the rapid stay, or the rapid sleigh, as they put on their whiteboard in that ward. While I was there, I get some blood removed, get some tests, and then from there, it's like a matter of just sort of waiting for results and waiting for certain doctors and surgeons to come down. And I just want to point out that, hospitals, they do involve a bit of waiting, and that's fine. It's a big building with patients in it. There is a lot of people to get to. Then at a point, I think I had like 3 doctors from 2 or 3 different teams, and they've come down. One's like an intestinal guy, one's an appendix lady, and then the other one's like someone who was on the team that did my colonoscopy back in October, which was pretty cool. But he wasn't there apparently that day. So I didn't get to ask him if he liked my jokes about turning the lights off if you're the last one to leave. I felt like I was on an episode of Dr. House, and there was 2 teams of doctors. One was like an intestinal expert, one was an appendicitis surgery expert, and they were like trying to go back and forth, and they were discussing whether they should cut me open, but then they should bring the swelling down, or try to find that risk of, what outweighs what. Because if I'm swollen, they cut me open, they might take too much, and I've only got so much to give. And so that's kind of a fun experience, having like a whole audience of people standing there, and you got the 2 doctors discussing things and surgeons. So very thorough team. I respect that. No one was too quick to pull the knife out. Made me feel safe and cared for. So from there, these team of doctors were discussing and talking and working out what the best approach is for me, and they went down the soothing the inflammation in case it's possibly Crohn's, rather than having to cut me open and trying to remove the appendix while everything's inflamed, because they could cut a little too much, and I don't want to give too much away. And from there, they found the best course of action, and I've been put on some medication, and I've been just like the inflammation's come down. I stayed overnight. Next morning, my pain level was down from like an 8 to a 9, come down to a 3. So I felt a bit more manageable and felt a bit more human. And so then I got discharged at about like 10 o'clock the next day. So Monday morning come in, Tuesday morning leaving. So it was kind of nice staying the night. And every step of the way, I want to thank all the hospital staff, all the hospital team members, all the people that I got to interact with, and all the ones I didn't, to help mend me and bring me back to a normal-ish level. So from the entire colonoscopy team from October last year. Thank you. And thank you for turning the lights off when you left. Then the MRI team, everyone there was so kind and patient. You know, I had a little minor little claustrophobic freak out. And because I couldn't hear anything. And she's like, you're all good. So they were all patient with me. So I thank them. Then the Irish lady, especially her, for not letting me leave. You know, it could have been just you take Panadol, you'll be fine. But she was like, hang on a minute. Let's look at your scans. Let's get a doctor to look at it. And then that specific doctor, I can't remember his name. I feel rude. It was all a blur. I can't remember any of the names. So, yeah, but thank you for that doctor for looking at it and recommending getting admitted. And then he contacted all the other doctors and surgeons relevant. And I want to thank the gastrointestinal people. I want to thank the appendix surgeon team. I want to thank all the audience of doctors that they had around that were contributing to the discussions and just all of it. And all the nurses and the team members in all the different wards, the 2 different wards that I got to stay in, they were so kind and lovely. Yeah, I do want to point out that I think peeling off the tape hurts more than getting the needle in your arm. The people who brought me food, that's pretty good too. That was really nice. Thank you. When I was finally allowed to eat. And all in all, just everyone there at the hospital. So thank you very much. Yeah, and also like the time they took. They really just took the time to explain things to me, and it was very nice. And I had any questions, I was like, what does that word mean? What does this mean? And then also helping explain it, explaining it to my wife when she finally got there, or my fiance, helping explain it to me and my fiance. And it's very kind, very nice, very patient team. I guess overall, kind of above all, I just really want to show my big picture appreciation for the fact that we get to live in Australia and we have Medicare and we have a really good hospital system. And so, yeah, thank you, Australia. Thank you, Medicare. And yeah, I don't know. It's great. So yeah, I didn't pay anything for that. I could have gone bankrupt if I was in the US as an example, but thank you, Australia, for taking care of us when we need it, and the hospital staff. So yeah, we have a pretty good country. But anyway, yeah, I'm mending up a bit now. I'm on some steroids to reduce the inflammation. I'm feeling a little bit better. And all in all, just wanted to say thank you, all the Royal Melbourne Hospital staff, and keep doing what you're doing. You're doing great. And if there's anything you need, let me know.